a part 2 where we'll be just again discussing the similar kind of problems. And also please remember the concepts are the same, just be thorough with your concepts and you can obviously answer the questions. So yeah, Mr. Satish Paul, I'll repeat the Swayam thing again at the end of the class, okay? Yeah. Okay. So, first question, deficiency of vitamin B12 may go undetected in vegetarians. Reason could be,
Option C.
yeah.
Option C.
So I see I have very good students in my class. They can answer correctly to all the questions. Really happy. Thank you. So option C, their folate rich diet which will mask anemia symptoms. So as we have thoroughly discussed that apart from iron deficiency anemia, vitamin B12 deficiency is also a very uh, common cause of anemia, right? So vitamin B12 deficiency can happen in vegetarians because the vitamin B12, it is mostly present in the meat, or they can be present in the dairy foods. And when the vegetarians, they are not taking in those specific food materials that contain vitamin B12, so obviously they can be vitamin B12 deficient. But then again, they might be taking some other they might be taking some folate rich food sources in their diet, which kind of masks the anemia symptoms. So hence it is very important to have a balanced diet for vegetarians also, because this vitamin B12 deficiency is a very common occurrence in vegetarians and especially in vegan mothers, right? So as we know, in vegan mothers, if there is vitamin B12 deficiency, there might be severe neurological manifestations in the babies. So it is very important to have a proper supplementation. If there is deficiency, it should be detected early, and that supplementation should be taken so that the baby is not deficient, or the baby is not facing any kind of complications. So yes, their folate rich diet which will mask anemia symptoms. Okay. So next question, a girl child whose weight was 3.2 kgs at birth suddenly starts dropping to the 15th percentile line at 1 month of age. What could be done to increase her weight?
Teach effective breastfeeding.
Right. So as we know, we have discussed the 50th percentile, right? So the 50th percentile is the average height or the average weight of the child on the growth chart. So for a girl child, it is around 3.2, and for a boy child, it is around 3.3. So what they are saying, if there is a sudden drop, so if it is 3.2, so that means that the child was born healthy. Now suddenly it starts dropping to the 15th percentile. So 15th percentile line at 1 month of age. So what might be the cause for that, right? So within that 1 month of age, obviously what is happening, or what is the source of food? It is definitely exclusive breastfeeding, right? So there is no other source of nutrition for the baby. It is just the breast milk. So if that breast milk is not being given properly to the baby, so then the healthy baby can face a decline in his or her weight, which is being happening in the situation mentioned in the question. So in this case, what needs to be done? The mother needs to be motivated, the mother needs to be taught the specific breastfeeding technique, right? So we have discussed about the cross cradle technique and why it is important, and how the specific positions and how the proper positioning of the breast and deep attachment of the breast tissue in the child's mouth, all of these are factors. So we have discussed about the factors of proper breastfeeding, right? So apart from local factors related to the positioning of breast and deep attachment of the child's mouth, the physical factors of the mother and also the mental well-being of the mother is also very important, right? So these things are also very significant, which needs to be kept in mind, and the mother should be motivated, right? So the mother should be in a position where she can actually take care of her own and also of the child simultaneously. So because of this, as the question goes, so teach effective breastfeeding technique. So it might happen that the mother is thinking, okay, she is breastfeeding the child, but then you see while monitoring there has been a constant decline in the weight. So definitely it might happen that even on breastfeeding the child is not getting the proper requirement. So that might be because of any erroneous technique. So hence it is also important to show them, like, obviously you have gone through the tutorials which have been given by the which have been shared with you. So these tutorials need to be shown to them, and they should be informed and educated about these breastfeeding positions and the techniques, right? So yes, the answer to this question is teach effective breastfeeding technique. Okay. So, I'll just repeat once again. Whenever you're going through these questions, please try to, just conceptually recapitulate all the related questions to it. So, cross cradle, what is the position and what is the advantage? Cradle, what might be the disadvantage? And when is the laid back position, the sideline position, when are all these indicated, right? So, please go through all those concepts as well. And irrespective of which breastfeeding technique it is, but still you have gone through the 45 points, right? So please go through the document very thoroughly, very carefully. So those 45 points, they are very important, and that will ensure that the mother is being taught a proper breastfeeding technique. And there are specific principles no matter what the breastfeeding technique is, but if those specific principles are being followed, that can be that can lead to the assurance that there is proper breastfeeding. Okay, so we'll move on to the next question. A baby is not able to breast crawl effectively. This could be because he is incorrectly placed. In which of the following way should the baby be positioned?
Option C.
Okay, what about others?
Is option C.
Right.
Option C.
Right. So the baby's tummy should touch the mother's tummy. So as we have seen that the baby should position in such a way that the baby is entirely in contact and the whole body of the baby is supported by the mother, right? So the baby should be in contact with the lower chest and the upper abdominal area. So in such a way that the baby's tummy is being in constant touch with the mother's tummy. So we know that definitely the skin to skin contact is important, and that is very essential to establish the instinctive behavior. We have talked about, we have discussed this in the previous sessions. Please go through it, the 9 behavioral indicators of the child. So how the baby gets into the instinctive movement, and during that breast crawl till the breastfeeding, and how the baby then rests. So what are these 9 behavioral signs or the specific situations or specific specific roles of those 9 points, how the baby goes through all these phases, right? So please go through those as well. So yes, the answer is the baby's tummy should touch the mother's tummy. Okay, so why do some malnourished children don't recover completely even after giving them the prescribed treatments for malnutrition?
Point D.
Yeah, so
Option D.
correct. So from the first session, we have studied about what is malnutrition and what could be the different phases and what could be the different indicators of malnutrition, and how we can figure out that okay, this child is malnourished, and then what is the specific what is so significant about effective breastfeeding, and why the complementary feeding should be started at the completion of 6 months. So we have studied about growth spurts, and we have also seen that if some child is deprived of proper nutrition within this first phase of growth, that can be advantageously utilized within the adolescence period. So at that time also there is a growth spurt, and so the body needs a higher amount of nutrition, and that can be given to the child to cater to the proper growth and development. So similarly, if a child is chronically malnourished, right? Yeah. So if the child is chronically malnourished, that means that in spite of all the attempts, there has been ineffective breastfeeding and improper complementary food. So we have talked about the the specific factors related to breastfeeding. We have talked why it is important to give the hind milk to the baby, right? We just talked about the different kinds of milk. So there might be chances where the mother is just feeding the foremilk to the baby, but the fat in the hind milk is most important for the child. So it is important to tell the mother that you should empty one breast and then you should continue feeding the child with the other breast. So that will ensure that the fat rich hind milk has also gone to the baby, right? So little things like that, they are very much important, which ensures that there is effective breastfeeding happening. And along with that, when the complementary feeding starts, so we have discussed what amount of food, frequency of food, and consistency of food, right? So these are very important. So it should be just imprinted in your mind that apart from these, it is these are the most significant factors which will determine how the growth will be in the baby, right? So yes, as the question says, in spite of giving the prescribed treatments of malnutrition, like after that phase, if the child is being given some external supplementation, still the baby is not being able to recover from that, because at the initial phase the breastfeeding was faulty and the complementary feeding was faulty. So hence it is again established that breastfeeding and complementary feeding are indispensable, and every mother should have proper knowledge about these techniques, right? So yes, they are chronically malnourished from the start due to ineffective breastfeeding and improper complementary food. Okay, so we'll move on to the next question. Breast milk can be stored up to how many days? Yeah?
7 days.
Right, 7 days.
7 days.
Yes, so I'll just quickly go through it. We have discussed if we are using the freezer, it will be around 4 to 6 months. If we are using the 4 degrees freeze, it can be around 7 days. And how the how the freshly expressed milk, if it's given to the baby once, it should be discarded. So all these material, it's there in the previous slides that the sessions I have taken for you people. You can go through it and just revise it. Okay, so I'll move on to the next question. Yeah, okay. The mother is breastfeeding regularly, but the baby is not growing well. Which of the following could be a reason for the baby's poor growth? Yes. So this also we have discussed. It is very important that the mother knows that it is the hind milk which needs to be given to the baby, right? So foremilk is very dilute. We have discussed hind milk, why hind milk is so important, right? Okay. And also how it can be inspected that the breast still has the hind milk, right? So please go through these questions over and over again. We have discussed these, okay? And once the mother inspects that, okay, now only a few droplets of milk is coming out, and there is the milk has been taken completely by the baby, and that is the point when the mother can shift the baby to the alternative breast. Okay, so yeah, we'll move on to the next question. In which week of pregnancy does the human brain begin to grow?
Third week.
Right, third week. So as we know, by the 5 years of age, the maximum growth of the brain already occurs. Around 90% of growth of the brain already occurs. And the human brain begins to grow at third week of the gestation, that is the during the pregnancy. So hence it is very important that it is not only after the birth of the child but also the pregnancy period. The pregnant mother should not be deficient in nutrients. So it is important that the mother takes care of herself, and only in that way the mother will be able to care for the baby. So unless and until the mother cares for herself, the baby will also be impacted, right? So that motivation is also required. The mother should have a healthy diet. The mother should be healthy, and accordingly after delivery, the mother should also simultaneously take care of herself and the baby, right? So yes, for the question's sake, yes, it's the third week. And also we have gone through like what are the nutrients which are responsible for the growth of the brain. So we know that these fats, the omega-3 fatty acids, they are very much important for the brain development. So during the first few months, why it is essential to give why the breast milk is so important, because definitely by the 5 years, if 90% of brain growth is happening, so that means within that fixed period the baby's brain needs the maximum of nutritional advantages. So that can be given through the specific these practices and the diet. So yes, the answer is third week. Okay, so next we move on to how much protein is present in 500 ml of cow milk.
16 grams. Should be 16 grams.
Right, 16 grams. So if you go through the slides again, I have given the breakup for how much protein is present in which kind of milk. So you can just go through and just recapitulate the amount of these nutrients, right? So yeah, how much of protein, how much of fat is there, so all of the macronutrients, you can just go through the amount. Okay. And also what I wanted to just remind you, please go through the daily requirements of the specific nutrients. Okay, I haven't kept the questions here related to daily requirements, but please go through how much of daily requirement is essential for men and women, children, at what age. Okay, so these are all there in the tutorials and the study materials, so please do not forget to go through the daily requirements as well. Okay, so next, fruits, as they have what fruits have the maximum amount of vitamin C?
Option A.
Right. So as compared to the ripe fruits, raw fruits are a better source of vitamin C. And we have also gone through the importance of vitamin C. So please just revise like what are the rich sources of vitamin C and how it helps. Okay, vitamin C helps in the absorption of what?
Iron. Iron.
Right. So as we know, iron is important. So vitamin C is equally important because vitamin C is helping iron to absorb. And as we know, even if that component is present in the body, if it is not being absorbed properly, so then it doesn't, the effect is not being obtained from that component. So it is very essential that proper absorption is also enhanced. So yes, vitamin C, the raw fruits are they have the maximum amount of vitamin C. Okay. So next question also we have discussed. So yes, the baby should be breastfed 3 to 4 times at night, right? And within a day it should be around approximately 10 to 12 times. Okay. We'll move on to the next question. What does the y-axis show in the length for age percentile growth charts?
Option
Answer,
B.
please. Yeah. What about others?
Length
Yeah.
in centimeters.
Yeah. So as we have studied the growth chart as to how to check which growth chart belongs to which gender and what age group, right? So yes, here the axes they stand for the age and the height or the length. So x-axis will be the age and y-axis will stand for the length. So yes, the answer is length in centimeters. Okay. So next, addition of which food will increase iron absorption among the following?
Gooseberries.
Yes. So as we know that gooseberry is a very potent source of vitamin C, that we know amla, right? So vitamin C rich foods like lemon, gooseberry, they increase the iron absorption. We have discussed, right? And uh, does anybody remember what is actually an inhibiting factor for iron absorption?
Phytates, tannins. Tannins. It's phytates, tannins.
Okay. So yes, so the phytates and the oxalates, they are called as anti-nutrients. So they kind of inhibit the absorption of any kind of vitamins and minerals. But specifically for iron, uh, which nutrient we shouldn't take with iron so that its absorption is not inhibited?
Calcium.
Calcium.
Right, calcium. So please remember, calcium should not be taken with iron, and this is very important when a mother is asked to, take iron tablets and calcium tablets, and it should be told to her very specifically that she doesn't, take these two kinds of tablets by mistake simultaneously. So then, in that case, the iron absorption will not happen, and obviously her iron supplementation will not occur properly. Yeah. Yes, Bhishma Rajiv, please go ahead. You have raised a hand. Is there anything? Okay, so I'll just go ahead quickly. Okay. Which food is added to the baby's diet after adding all other food groups?
Fruits.
Yes. So as we know, okay, I can see two people have raised their hands. Maybe you can just write down your queries in the chat box. Okay, I'll come back to it. So fruits, yes, because of course, when we know that there are different kinds of food groups and the different kinds of tastes that we are trying to introduce the baby to. So the fruits are of sweet taste. So the sweet taste should be the last taste that needs to be introduced to the baby, because if that taste is introduced to the baby at first, so the baby will be more drawn towards the sweet taste, and the baby might be more biased towards food which tastes sweet, right? So fruit should be introduced at last, because also, because they are very sweet, they have a higher sucrose content. And second, when you are giving fruits to the child, it should be whole fruits, right? So whole fruits should be given to the child instead of fruit juices or mixing the fruit pulp into different other food groups. So this should be avoided, and whole fruit should be given to the child. Okay. So next we have, in how many days should a new nutritious food be added to the baby's diet?
Every 14.
Right. So all of you people are very much ready for the examination, as I can see. So yes, every fourth day. So we have 8 food groups, right? So every fourth day a new food group should be introduced in the child's diet. And also, say for suppose a child is not eating a food group or denies to take in a specific food group, the mother should try to introduce at least the food group at specific gaps for at least 15 to 20 times, right? So it is definitely the mother needs to try for a lot of time so that the baby gets acclimatized to the entire taste, smell, and texture of the food. So it is
Glass
very
score. Easy.
yes.
Glass chain.
Sorry, can you please? Okay. Yeah. So as we have just discussed, every fourth day the new food needs to be added, and also the mother should be very much motivated to keep on, giving these foods at regular intervals so that the baby is trained to eat different kinds of food classes. Okay. Next is, what is the average weight of a 1-year-old girl in kilograms? Okay.
9.
Yeah, I'll just quickly go. So 9. As I have said, please go through the values, right, from the examination point of view. Next, we have, which hormone encourages the letdown reflex?
Oxytocin.
Yes,
Oxytocin.
oxytocin.
Option B.
Right. So oxytocin, as we know, that whenever there is proper suckling and there is yeah. So whenever there is proper suckling, so obviously the brain gets a signal that okay, there is need of producing more oxytocin, right? So this oxytocin will enable more release of milk from the breast. So that is the letdown reflex, and hence oxytocin is so much important, right? And also please go through the questions where we have studied about when you know the prolactin levels are high, and the different how the different hormone affects the formation of the milk and also the release of the milk. Okay, so I'll just pass on to the next question since we have discussed all of these in detail. Okay, next is, the risk of which of the following are increased by iodine deficiency during pregnancy?
Miscarriage. Miscarriage.
Right.
Point C.
So yes, miscarriage is the most the obvious answer, but of course the diminished growth of fetus might also be there, which is an indirect this thing. But obviously, since you have to like choose the correct one correct answer, so of course the answer is miscarriage in this case, right? So yes. Okay. So second, next question, if the mother is vegan, what deficiency her baby may most likely have if she's breastfeeding exclusively?
Vitamin B12.
Yes,
Vitamin B12.
absolutely correct. So we have discussed if it's vitamin B12 if the mother is vegan. So vitamin B12 deficiency is very common, and that might lead to neurological effects in the baby. So hence, since a lot of people they want to be vegan nowadays, but it's they should be educated thoroughly so that they know which decision needs to be made, right? So yes, vitamin B12 deficiency. Okay. Next question, milk from mothers of premature babies is rich in which of the following? Milk from mothers of premature
Infection fighting proteins.
Right. So as we can see, the question says premature baby. So of course the baby is premature, and hence it is important that the immune components, they definitely have to be transferred from the mother, right? So yes, the milk of mothers from premature babies is rich in infection fighting proteins, or we have discussed about antibodies in details. So yes, option B is the answer. And last problem for the session would be, which babies should not be breastfed during the COVID-19 pandemic?
D.
Option D.
D.
Right. So we have been learning about the importance of breastfeeding all throughout the course, and these are some myths that now needs to be broken, that okay, these babies cannot be breastfed, or these mothers should be refrain from breastfeeding because of different clinical conditions. But of course all babies should be breastfed, and according to the standard infant feeding guidelines, right? So the answer, the option D is the answer. And yeah, I remember there were a few questions regarding whether patients going through chemotherapy can feed or not. So if you go through the previous lectures, I mean previous sessions, you can also see there are different guidelines which have been suggested that how, I mean there are specific guidelines how the mother can still breastfeed their child. It is not a complete contraindication, and there is no condition which says that the mother cannot breastfeed the child, right? So these are some informations. I mean, since going through the course, we have been the responsible people. We have come to know a lot of new information, and it is important that along with us, we also educate the people around us who do not have the access to such kind of information, right? So with that, I conclude today's problem solving session, rather the problem solving sessions for the course. And these were just problem examples, and please go through these questions and try to recapitulate the concepts. And we have very elaborately discussed them in all the sessions, and I think there shouldn't be any problem in examination or anything. Okay, so with that, I thank you for being with me throughout in all the sessions, and also all the best for your examination, right?
Thank you, ma'am.
Yes.
Thank you,
So,
ma'am.
right. So I'll just quickly go through the queries which are being.
Ma'am, I wanted to know if there are more than one correct options, then
No. Questions would be given which have a single correct option.
okay. Thanks.
So even if you feel that there might be two correct answers, so please stick to the most obvious one, right?
Okay, ma'am.
Yeah, and mostly we have discussed all kinds of problems which might come, and I think there shouldn't be any problem, related to solving the questions. Okay, so I'll just. I'm sorry. Okay, can we consume iron and calcium rich food together like beetroot and curd? Okay, so here again the iron and calcium amount is very important as to how much rich the source of food is in that specific nutrient. So beetroot and curd is considered to be a very good source. So I think that can be taken, but that can be taken together. But of course, with respect to specific nutritional values, maybe I might also have to look for some more information, right? Okay.
Okay, ma'am. Thank you.
Yeah. Next is, ma'am, I was asking whether we need to study RDA also. Okay, yeah. I have just mentioned the daily requirements. You can just go through it. Maybe you can get questions here and there, and it will also be essential for you in the long run, right? Okay, so other than videos, what we should refer importantly on Swayam app regarding exam, right? So as I was saying, so there are the recorded lectures by Dr. Rupal Dalal, right? You have your assignments, and there are the problem solving sessions which have been specifically taken by both of us, like me and Miss Amrita, the PMRF TAs. So you can go through the problems that have been discussed, the kind of problems, and also the kind of problems you have solved in your assignments, right? So these are the kind of problems you'll also be getting in your examinations. Okay, so it would be MCQs, and it would be a one correct answer kind of MCQ only. So if you thoroughly go through all kinds of problems we have discussed, I am sure you won't be facing any problem in answering the exam. Okay. Okay, thank you, thank you, thank you. Ma'am, where is the examination center? Okay, you will be receiving an email regarding your examination center. Okay, thank you. Okay, any negative?
Thank you, ma'am.
Yeah. Any negative marking? Okay, I am not actually very much sure about the marking scheme. So, I think Dr. Rupal Dalal is the one to decide that. But very honestly, I don't have the negative marking information. Okay, sorry for that. Okay. 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 Thank you for the great words. Yeah, it has been a really good learning experience for me as well because I got to know a lot of, you know, different people from different backgrounds, and I'm really inspired by all of you. Like many of you are like, I mean, even at this stage, you are so much motivated to, you know, learn and go through the entire process. I am really inspired by you all. Yeah. Thank you. Thank you. Okay. Another question is where we find all important charts. Okay. So the thing is, if you go to the folder that has been shared, you know, just beside my name. So I have tried to provide you the nutrition chart and the 45 points, right? So you can go through that, and NPTEL, from NPTEL you will be shared the learning action protocol charts and also the growth charts. But apart from that, if you want to just go through it, you can the charts are there in the solving problem solving sessions, so you can just go through the slides also. Okay, I think that would be helpful. Okay.
Can I tell in between?
Yeah, sure, go ahead.
See, apart from the academic, whatever information we got it, the videos are so excellent. The pictures of the lady, and usually we get somebody foreigner. I think there is a double sound.
Sorry, I think your voice is breaking. Can you just repeat again?
It is double coming, I think.
Is anybody unmute? I mean, I'll just check. Yeah, please go ahead. I'm sorry, I just couldn't get you.
All the videos, I think it is breaking.
Maybe you can just jot it down in the chat box. I'll just go through it. Yeah.
Are you able to hear properly now?
Yeah, I can hear you. Go ahead.
See, all the information is really good, but one creditable thing is the videos. I think the IIT people, what they have created.
Yes.
See,
definitely.
as I am a clinician, we see only the pictures of somebody from abroad, like American or European child. Here, the ladies are typically of our setup. And maybe we doctors, it's okay, but others can relate very easily with these videos. Because it is actual, like the lady wearing salwar kameez or the way it is done. I think it's really impressive. I think we are impressed. Maybe knowledge we are definitely going to get it.
Yes.
But the visual impression is excellent.
Yes, it is really, I mean, it's really commendable how Dr. Rupal Dalal has actually been heading the entire initiative, and how the entire team of IIT Bombay also, you know, executes all of it. So even for me, being associated to them through NPTEL also, it's a huge thing for me as well, because along with you, I also learned a lot of things. So yes, definitely. I mean, the tutorials, I mean, that is how they are helping us all throughout, right? They are like very clear videos, and the tutorials are really excellent. Yes.
It is more Indian, so the connect is good nice.
Yeah, definitely, because that is how they are working at the ground level, right? And I mean, apart from the, yes.
And no, absolutely. So that is the reason why, you know, it is so connectable, it is so clear, and it actually gets into our head.
Yes,
So this-
yes. Definitely,
Trust me, to be
definitely.
frank, your sessions are really, you know, like the moment there's some keywords which come to our brain, you know, it comes to the connect with your sessions, like, you know, how you put it to her, he just very neatly put it to her brain that we can never forget that. You've done a great job. Thank you so much.
Thank you for patiently being there in my class and listening to me. Thank you very much. Okay, so we'll just wind up the last session here. It's really been a great opportunity for me as well. Thank you and all the best to you again. Okay,
Thank you so much.
thank you. Okay. Thank you for all the hearts that I've been getting. Okay, thank you very much.